Welcome to the modified version of butterfly to hip internal rotation training. You're going to need some yoga blocks and a bolster to begin. We're going to work on our 2-minute passive inner thigh stretch. So just get into position as deep as you can hold the stretch. And then we're going to work on some expansive breathing. So 4-count breath in and a slow 8-count breath out. That's going to help train our nervous system and helps us to work on that expansive breath through our rib cage, which only further supports our training. So let's take a breath in for a count of 4 and breathe out for a count of 8. Go deeper into the stretch as you can tolerate as it opens up. Breathe in for 4. Expand that rib cage and belly and breathe out for 8. Breathe in for 4. Expand that rib cage and belly. Help that tissue relax as you breathe out for 8. Moving deeper into the stretch as you tolerate. Breathe in for 4. And out for 8. Think about lifting your chest to keep your back straight as you hip hinge deeper into the stretch. That will help you feel it more in the inner thigh. Breathe in for 4. And out for 8. Move deeper into the stretch as you tolerate. Breathe in for 4. And out for 8. In for 4. Expand that rib cage and belly. Build your capacity and breathe out for 8. Slow and controlled breath. Breathe in for 4. Keep those shoulders out of your ears. And breathe out for 8. To begin training, we're going to stay in this position, the butterfly position. You're just going to open up your posture. So sit up tall and move your feet away from you to open up a range of motion that you can work. And just lift your legs to check your capacity there. If not, just open up your posture more by sitting on a higher bolster, moving your feet away further, leaning back. I'm going to show you with my left leg, and we'll begin with the left leg. The motion, so you're going to shift onto the opposite hip slightly to give you range. You're going to lift the leg that we're working, and then we're focused on only rotating that thigh in the hip joint, and then here you'll start to extend a little bit. As the ankle and foot tap the floor, then you're going to internally rotate that thigh in the hip joint, working to try to tap the inside of that knee to the ground without moving your pelvis or anything else. And then lifting that leg, externally rotating, and bringing those feet back together. Okay, so full irradiation, you want to max this out, your foundation, so that you can create as much adaptation as possible. Now lift that left leg, rotate that thigh in the hip joint. Smooth, slow, controlled motion is what you're aiming for. The leg should try to extend a little bit there as you tap the foot down. Compress the foot into the ground. Really use the tension, the rest of your body, to allow you to get that knee, inside of that knee, to tap the floor. And lift. Remember, a smooth arc. You're going slow and controlled. Now here, really make sure you don't use momentum. Get that hip flexor to engage as you lift the leg and start to externally rotate that thigh in the hip joint. See how my body isn't moving or shifting around. So really make sure you use that foundation to support you, and bring that leg to the end point, relax. Now we're going to reset. Full irradiation, your maximum, safest, and greatest. Lift that leg. Rotate the thigh and the hip. Don't let anything else move, and try to go as smooth with your motion and controlled as you can. Get that foot down, and now you're going to rotate that thigh to to the inside, trying to tap that inside of the knee to the ground. If you don't get there, just work at it your best. But again, increasing that foundation and the tension everywhere else is going to allow you to open up into new ranges and gain new control that you haven't had. Don't use momentum. Use that hip flexor. Control that thigh lift as you externally rotate and bring those feet back together. Good. Bring it all the way back to the start point, then you can relax. Okay, reset your tension. Full safest and greatest irradiation. Lift your leg. Rotate it in the hip joint. At that last little bit, the thigh is actually going to be extending back a little bit to bring that foot down. And slowly bring that inside of the knee to tap to the floor. Basically, we're working on the transition from butterfly to 90-90. A really powerful movement that, if you master, really helps you gain control and stabilization through your hips. Good. Control it all the way back to the start point, then relax. Okay, switch your arms for the other side. Remember, we're working the right leg now, so you're going to shift slightly onto the left hip. Okay. Get your tension. Take a breath in. Let it all the way out. Lift that right leg. Rotate the thigh in the hip joint. Don't move anything else. Extend slightly. Tap the foot down. And control that thigh so you're tapping the inside of the knee to the ground. Use your foundation to get you as far as you can. As soon as you tap, you're going to lift. But again, the motion is all the same pace. Be careful here. Make sure you get that hip flexor engaged so you're not throwing that thigh up. You've controlled the motion. Nothing else is moving. Externally rotating, bringing those feet back together. Control it right back to that start position. Then you can relax. Reset your tension. Full safest and greatest. Lift the right thigh. Rotate the thigh in the hip joint so you're bringing that foot behind you. Extend a little bit. As that foot lays down, now you're going to control that rotation of the thigh so you're tapping the inside of the knee to the ground. Smooth, slow, and controlled. Tap, and when you lift, remember that motion needs to be the same pace. You're not doing any quick lifts, especially here, trying to cheat with that momentum. You're going to control the motion. Be very deliberate. Tap those feet together. Let that hip externally rotate even further to your start and relax. Last one. Let's reset. Full safest and greatest. Lift that right thigh up. Rotate it inside that hip joint. Don't move anything else in your body. Extend a little bit to get that foot down. Bring the inside of the knee to tap to the floor. Use your foundation to increase your capacity. The motion should only be happening for the thigh at the hip joint. Your pelvis shouldn't be moving around. Your torso shouldn't be shifting around. We're trying to make as much change as possible. Make sure that hip flexor is engaging to control this motion. Don't just throw that knee up. Good. Control that external rotation. Bring those feet back together. Open that hip up to that start position, and then you can relax. Great work.